Welcome back. We are continuing on Tana's recovery. We are 2 weeks post-surgery. And as we do, whether it's raising kids or being married or dealing with the mental health issue, whenever they sort of affect us, we're going to share them because we know that they may help you.
Well, there's a lot of people dealing with similar stuff, So
I'm going to read a couple of testimonials. I'm a month into the supplements after having my SPECT scan done through my psychiatrist, and it's making a world of difference. I love the books. Dina Bear Time, thank you so much. I mean, we're here to make a difference in your life. Also, from Dane the Dancer. I love that, Dane the Dancer. I feel less alone with the struggle of telling that my form of autism caused by a vaccination at 12 months, I had the similar symptoms. That episode makes you more of a saint than ever. Feel that SPECT scan should be the norm for all children diagnosed with autism. How do you know unless you look?
It's one of the things that I've often, as a parent, I often tell my daughter, it's like, feeling alone is like the worst thing. And anything you're going through, people tend to feel, whether it's shame or pain or fear or whatever it is, when you do it alone, it's so hard. So, pain shared is pain divided. So it's really important that you don't feel that aloneness. You need to have, someone that you share that with.
Well, and building a community, that's why we're grateful you're part of our community. But being connected through the podcast, through church, through your family, through your friends, it's just super important.
Yeah.
So you had a number of epiphanies around drugs.
I did. So you have to excuse me. I'm wearing my yoga clothes today because I still can't wear anything tight on my body. So everything's just loose and t-shirty today. So if you're watching the video, that's why. But yeah, so we've been talking about all the things you do to prepare going in and all the things you can do afterwards to make sure you heal faster and feel better fast, right? So, but something happened that just really woke me up to what some of our patients must feel. And I had this different level of empathy. It was sort of weird. So I don't do well with pain medications to begin with. I just I hate the way they make me feel. Just that nauseous kind of like, bleh, don't like it. But you have to take them for a couple of days, right? So I took pain medicine for the first 48 hours because that was really the rough part. And then after that, I only took them for a couple of nights because I couldn't sleep at night if I moved. So I took just one pain pill at night before I went to bed. But I still had to do something for sleep. So I started taking over-the-counter. You'd think over-the-counter medication, no big deal. I took some Advil with Benadryl in it. The lowest dose of Benadryl, 12.5 milligrams, lowest dose you can do, just to help me sleep so that I could get my sleep. We just got done talking in the last episode about how important sleep is. So I knew I needed to sleep. I don't want to be waking up all night. So I am doing everything I can to not take like these toxic levels of drugs, take the minimal amounts, take things, that I can. What's the balance between not feeling so much pain and sleeping and all that? And I was doing really well. I was sleeping a lot. I was doing really well. First couple of days were fine. And all of a sudden, by about day 6, when I should be doing a lot better, I start noticing that I'm just very apathetic. And I thought, okay, well, maybe that's just still surgery. There's like a lot of apathy. And I get up, and even Chloe got really nervous. My daughter got really nervous, and she came down. She's like, I'm not used to seeing you like this. I was so tired. I felt like I was walking through mud, couldn't focus. I sat down to try and do my meditation, could not focus on meditation, could not focus on my Bible study, couldn't focus on anything. I just didn't care. And I was so tired and nothing made sense. And I just laid there like a bump on a log. And then I tried to go out and do something. On the first day that I could finally go out and do something, I barely made it through, came back home, went right to bed. And then it occurred to me on about the 8th day, I'm like, I'm going to try sleeping without the Benadryl because I don't know what's doing this, but I feel terrible. Maybe it's just post-surgical. I don't know. So I went to sleep without the Benadryl, woke up the next morning, bam, jumped out of bed. I was like, whoa, it's a whole new day. Like someone lifted the fog. And then from that point on, I was fine. I was absolutely fine, back to myself, still tired. Don't get me wrong. I'm still have to recover and I'm tired. But I didn't have that depressed, apathetic, sort of can't focus on anything, don't care about anything
A
feeling.
lot of people use Benadryl to go to sleep at night.
Yes, my sister was using 50 milligrams. So I don't even know if that's like allowed. But anyways, she was like, it's definitely not suggested. So my point is, yes, we want you sleeping. But my epiphany was this. People are coming in here. Sometimes things are so broken. They're hurting so badly. They're so broken. They're doing everything they can. I know, I've seen it. I've experienced it personally with my family, where they are so broken, they don't know what else to do. So they're just doing what they can and taking whatever medicine they can to help them survive the moment. I get it. But we're giving them stuff to do that's going to help them feel better, and they can't focus on it. I know they can't, because I certainly could not. I could not. And I was taking the minimal amount of an over-the-counter medication, and within a couple of days, I was not myself. And it just occurred to me that we need to be really aware. You know, I know you are aware. I'm not saying you're not. But it really helped me think about what people are going through internally if they've been taking these drugs for a long time. Like, this epidemic with opiates is tragic.
So I want to actually say that in a published study, in a report published in JAMA Internal Medicine this month, that long-term use of anticholinergic medicine,
Like
so
Benadryl.
these are medicines that decrease the neurotransmitter acetylcholine, like Benadryl, increase the risk of dementia. And I think you were feeling, I mean, obviously you weren't demented, but you were beginning to feel cognitively, I'm not as sharp,
I
I'm
just
not as
felt
happy.
terrible. Definitely not happy.
And so this is really important because, you know, the medications that your doctor puts you on, often without much thought,
Well, on some
like
but
Benadryl.
wait, some of these you can just go get on your own. You don't even know anything about them. You don't know what the side effects are, and people just go buy it and they just indiscriminately.
You're not supposed to be this excited after surgery.
No, I'm telling you, this struck me so strongly.
I'm your nurse. You have to calm down.
This is
calm
important.
down.
People are able to take this stuff with really no knowledge of what it's doing to their brain.
You're absolutely right. And the other huge issue that we haven't talked about is naive systems. So people who've never had narcotics are getting narcotics and then they get hooked on them because
I don't know how.
because you're not like, well, in so many ways,
I'm not normal.
everybody. But a lot of people, once they start narcotics, they can't stop them.
I know, I understand
because when they take them, all of a sudden they feel better.
But I think
wait, let me finish. They feel almost what they believe other people think as normal. Now, obviously, these opiate narcotics, they're dangerous long term, and they can cause addiction. And as we've seen in this country, they can steal your life. So the take-home point for this is if you have had surgery or your wisdom teeth removed and somebody gave you an opiate, like Norco or Vicodin, or Percocet or Percodan, or morphine, and you felt really great, don't keep taking them. Bad idea. Really, really bad idea. Let me finish.
Okay, then I have a question.
Let me finish. Go do acupuncture.
Oh, I love acupuncture.
Because acupuncture has been found in studies to actually work through the same endorphin mechanism in the brain, but rather than make you stupid over time and give you constipation and addict you to it, it can actually increase blood flow, improve your mood, and help rebalance your system overall. Okay,
so two things. Because acupuncture, you thought I was being like, you thought like it was all in my head. Because I just tried acupuncture for the first time prior to surgery. I wanted to like get my body all ready for surgery. And so I tried acupuncture and I I cannot believe how good it made me feel. I'm like, this can't be real. Like, this cannot be real. And you just started laughing at me because I'm like, there's no way someone sticking needles in my body is making me feel this good. But I felt so good and I slept so good. It was amazing.
You were so much better.
I was so happy.
And I don't usually think of you as a placebo
No, I'm
responder.
actually cynical. I'm pretty cynical, actually. Now, one more thing I want to go back to because this is too important and I didn't want to forget about it. That's why I kept bothering you. You talked about people feeling normal when they take the painkillers. When people start taking painkillers like that, if they have to take it for any length of time, because I have somebody that I know right now who's gone through a surgery where they're actually just really in a lot of pain long term. It's like a long-term chronic pain. That's where it's dangerous, I think. Are those opiates one of the drugs that actually change your brain function and make you dependent chemically?
Yes, there are actually many medicines that I call them insidious, in that once you start them, they change the function of your brain in order to need them. So you just
scary.
want to be thoughtful, careful, like benzos, opiates, serotonin drugs. That doesn't mean you don't need them, and it doesn't mean they're not helpful. But if there's another way to do it, it's worth thinking about other ways to do it. So hypnosis can be really helpful for pain, omega-3 fatty acids.
Yeah, now I'm back to my meditation.
And I think for you, since you got that really great response from acupuncture,
I can't wait to go back.
That it's not a bad thing to do. I'm getting ready to film my new public television special, Feel Better Fast and Make It Last. And I was reading through the acupuncture and acupressure literature, and just a super simple exercise like rubbing the bottom of your earlobe. So just slowly rubbing your earlobes between your thumb and your first finger, that it sends a relaxation response. Now, if you have big ears like me, then you can, you have a lot of rubbing room to go. Another one
is this one. Yeah, feels good.
There's an acupressure point. Next, it's actually over here. An acupressure point on your wrist. That when you hold it, again, it has an anti-anxiety effect. So many simple things we want you to do before you go after some of the heavy-duty meds that you may have trouble stopping.
Yeah, one of the things that made me realize that it might be the Benadryl that was doing it, that made me like, okay, maybe I just need to try stopping this altogether. Because it just didn't occur, like I didn't ask anybody. I was just taking Benadryl, right? Because I was taking a tiny dose. You just don't think about it. But I remembered that I had taken, many years ago, I was prescribed after some procedure, they gave me Ambien to sleep. And after 2 days of taking Ambien, 2 nights of taking it, I would burst into tears uncontrollably. And I was like, what the heck? I was like, it made me crazy.
Well, that was actually a huge gift for you.
Oh,
because
my God,
Ambien's another one of those medications that once you start it, it's really hard to stop it. The New York Times just did a whole article on psychiatric meds you cannot stop.
Oh, that one was awful.
And I would never want to start something that I couldn't stop, that I would begin to lose control over my own mind. I have enough trouble controlling it.
So I just wanted to put that out there because I want people to think about...
This was a really good podcast. You're so smart.
Well, actually, I don't know if I'm smart. It was just an epiphany I had that I think it gave me a lot of empathy. Because people start taking these meds for a lot of various reasons, and they end up in trouble. And it just made me realize, wow, they can't sort of... It's not that they can't. It's hard to do some of the things, even though they're the right things. I was eating terrible for a couple... Well, there's not really much terrible in my house, but I was eating terrible for me. Okay, so and I even asked you to go get me this bean and cheese burrito, and you looked at me like, what? We're like, what are you doing?
I can't be seen in public.
Well, but my point is I just didn't feel good, and I didn't care, and I wanted something like comfort. I was just like, what is going on with what is the matter with me?
Are we blaming that on Benadryl?
My overall mindset was completely not the same. It was just not the same. It was just very weird.
So what is the parting word you want to leave with people for surgery week? What are the big ideas that came from your experience?
Okay, so I think these podcasts will help. So be prepared in advance. Get your body completely ready in advance. Ask the right questions. Prepare your environment. Prepare your mind. Do everything you can on your side to be as healthy as you can going in. So build your reserve. You've got to build your reserve. That's really important.
Armed, prepared, and aware.
Right, and you got to have that physical
a warrior
reserve.
doesn't start training on fight day.
Right, you got to train before fight day. You got to be ready. So build that reserve. Be ready to go. But then also have this knowledge about what's going to happen, not just with your body. Like I asked all the questions about what's going to happen with my body, what's going to happen with, the recovery, what's going to happen. I knew all that stuff. I didn't really think about some of the other things. So this podcast can help know what's going to happen with the drugs, know what's going to happen with the recovery, know what the potential complications are, so you can just have a plan.
And
right?
Get your mind and your body in the right state. Don't pollute it with a lot of negativity. Start with today is going to be a great day. Finish each day with what went well today. That'll get your internal environment to be healthier.
And have a really good support system. I mean, that really made all the difference.
Stay with us.